Hi everyone, I'm Dr. Arland Hill with PaleoLifestyleDoctor.com, and today I want to spend a little bit of time talking about normal thyroid levels. Normal thyroid levels can be a little bit confusing sometimes because there's some misconception about what is an accurate thyroid level, what numbers should you be looking at. So what I want to do is I want to zero in on three things that are going to help you decide what normal thyroid levels look like. So the first thing I want to share with you is TSH. TSH has been the marker that a lot of time is dependent on diagnosing whether or not someone is hypothyroid or whether they're not. So TSH, I will tell you, especially in my observation, individuals that have been put on a medication, TSH is not a good number to look at. So if you're really trying to look at and zero in on what your thyroid levels are, TSH is not the marker to be looking at to do this with. The thing to remember about TSH is that it's a hormone that's produced in the central portion of the brain, and it is secreted down to the thyroid to then instruct the thyroid gland to produce thyroid hormone. It's not the actual thyroid hormone. To get a better assessment and understanding of the dynamics of how thyroid hormone is being produced and how it's being converted into its different forms, the markers you really want to look at to make this determination are going to be T4, free T4, T3, and free T3. And of these, free T3 is really the one you want to be looking for here, because free T3 at the end of the day is the active thyroid hormone. That's the one that's really getting the job done. So definitely keep an eye on these markers as opposed to looking at TSH. The second thing I want you to think about with trying to figure out normal thyroid hormone levels is to recognize that normal thyroid levels are really dependent on other hormones. Hormones act in concert with each other. Hormones don't act in isolation. So we really have to take into consideration what the other hormones are doing as it relates to the thyroid itself. The three core ones that we like to think about here are going to be estrogen, testosterone, and cortisol. And these are significant. Your estrogen and testosterone are going to influence how thyroid hormone binds to different proteins that transport it around throughout the body. And your cortisol, many of us will recognize cortisol as a stress hormone. Generally when there's imbalances in cortisol, we think about changes in fatigue, how we are able to get up and accomplish our activities, maybe waking up through the night, waking up with a headache, these types of things. But cortisol, as it relates to thyroid hormone, cortisol directly influences how thyroid hormone is communicated back to the brain, the levels that are circulating, how that communicates back to the brain, to then in turn tell the brain to tell the thyroid to produce more, to produce less. The direct ability of the thyroid hormone to be produced from the gland is affected by cortisol, so definitely some impact there. And then you're also going to get effects in converting from this inactive form of thyroid hormone, the T4 to the T3. That conversion is directly influenced by cortisol also. And probably one of the areas where the effects of cortisol are especially noticed at is that when you have thyroid hormone in the system and you're looking to get that thyroid hormone to have an influence on the cell, to make that cell respond to that thyroid hormone so that it can then in turn turn on your metabolism and cause some metabolic effect, you've got to have cortisol to stimulate that activity. That cortisol tells that cell that it wants to respond to thyroid hormone to allow you then in turn to have a better, faster, more efficient metabolism. So these hormones definitely have an effect. And then third, as it relates to the diagnosis of hypothyroidism and one of the things you want to be considering in terms of looking at normal thyroid levels is that you may very well have normal thyroid levels, but you may not have adequate thyroid hormone activity by virtue of the fact that you may have an autoimmune component or what's known commonly as Hashimoto's. Hashimoto's is the most common cause of hypothyroidism, so it definitely should be on your radar. And if you're not looking at what are known as the antibodies, the thyroid antibodies, to help you get a full picture of what you have going on with thyroid hormone, you really want to look at those thyroid antibodies. They answer the question of whether or not you have the most common cause of hypothyroidism or not that's occurring. The things that are going to be most related to this in terms of food, gluten is number one on the list. We know that there's a correlation between celiac disease and hypothyroidism. or Hashimoto's, celiac disease and Hashimoto's, which is again that most common cause for hypothyroidism. So we want to consider that. Soy has proven its impact on negatively affecting the thyroid. And then sugar, and probably more generically we can say that as refined foods. These definitely have negative impacts on the thyroid hormone as well as they do on cortisol, which again we talked about how that affects the thyroid. So if you're really looking at trying to understand more about what your normal thyroid levels are, or what does a normal thyroid level look like for you, keep in mind that you don't want to really be looking at TSH. You want to understand what these other hormones, the estrogen, testosterone, and cortisol are doing, and you want to get away from these trigger foods, which may be related to Hashimoto's, which again is the most common cause of hypothyroidism. So keep these things in mind when you're trying to figure out your normal thyroid hormone levels. I appreciate you taking the time to listen. I'm Dr. Arland Hill with PaleoLifestyleDoctor.com. Thank you.